So I think, Michelle, that venous leg ulcers and arterial ulcers are something that all healthcare professionals probably find really difficult to manage. The key, I think, to being able to treat a venous leg ulcer or an arterial ulcer is the diagnosis and ensuring that the diagnosis of those is correct. And how do we make that diagnosis between a venous leg ulcer and an arterial ulcer?
So by looking at a wound on the lower leg, can you tell by looking at it if it's a venous leg ulcer or an arterial ulcer?
I think somebody that's probably very experienced looking at venous versus arterial disease probably could. Somebody that isn't particularly well versed in looking after wounds on the lower limb that maybe are venous disease, arterial disease, or a combination of both might find it more difficult. But there are some subtle differences in the wounds or the wound types.
So when we have a patient that has an ulcer, it's really important to have an effective diagnosis. So using diagnostic systems like ankle brachial pressure index systems and Doppler systems, it's really important to be able to identify and distinguish between venous leg ulcers and arterial ulcers. And that, alongside a really robust history of the patient and any underlying disease that might be occurring, is really important.
Absolutely, and it's really, really important that the people that are carrying out these diagnostic tests are trained to do so. So if you haven't been trained in how to use a Doppler or how to calculate an ABPI, then it's really important that you escalate that to somebody within the team that can do that to ensure, obviously, the patient's safety and to make sure that the treatment we then are going to give that patient is appropriate and safe for them to have.
So knowing the difference between a venous leg ulcer and an arterial ulcer is crucial in the treatment plan for your patients. And this is so you can provide the correct treatment, whether that's compression for a venous leg ulcer or potentially surgery for an arterial ulcer. And identifying the difference between the two is really important to wound healing and the holistic care for that patient.
So I think it's really important when it comes to looking after patients with venous leg ulcers or arterial ulcers to make sure that we have that multidisciplinary approach. If you're unable to make that diagnosis, unable to complete those assessments, it's really important that we escalate that to somebody that can.